To begin with, I'd like to also acknowledge the Wurundjeri Woi-wurrung people, the traditional custodians of the land where we are today, and also pay my respects to elders past, present, and emerging of the Kulin Nation, and extend that respect to other Indigenous Australians attending here today. I'd also like to thank Dr. Sharman Stone and her colleagues at AIFS for inviting me to make this keynote presentation, and to Chris Schilling for his very warm introduction. And I'm very honoured to be given this privilege, and very honoured as well that the Minister is still here to listen. I think you'll find that she made half my presentation already. She talked about 1.2 million Australians living in food insecurity. She talked about high rates of income disadvantage and income immobility. She talked about long-term poverty and disadvantage and gaps between haves and have-nots. And that's really what I'm going to be talking about in my presentation too. So,
by 1990, no Australian child will be living in poverty.
Having made that pledge in 1987, Bob Hawke went about trying to achieve it. He increased targeted family payments in particular, and he didn't, as we all know, manage to eliminate poverty. I don't think he intended to say he was going to do that. But it did decline after he made that pledge. And I'll talk again towards the end about the importance of making commitments towards these kinds of goals. So, in this presentation, I really want to make 3 points. My first point is that children and young people have a right to speak out, and policymakers not only have an obligation to listen to them, but they also have an obligation to act on what they hear. The second point I want to make is that children and young people have a right to support and opportunities, as the Minister said, that allow them to develop to their full potential. I'll aim to show that this is particularly important in these post-COVID times that we're living in. And my third point is that inequality in society matters for children's and young people's well-being and development. The more inequality and associated problems of poverty and deprivation that exist in Australian society, the harder it is for all children and young people to reach their full potential. If we want children and young people to maximize their life chances, we need to address overall levels of support for families and levels of inequality in society as a whole. Policy responses to COVID have shown what is possible. Policymakers in this new era have an opportunity to be much more imaginative in addressing the challenges that marginalized young people face. One issue I will touch on relates to the adequacy of current education, health, and community systems we have in place for addressing young people's needs and supporting their development. This has been an issue right through the conference in every presentation I've seen so far. And also it's clear from what people are saying that these services need to do better in addressing the needs that young people articulate. I will also argue, though, that we need to keep an eye on the big picture. The more inequality, poverty, and deprivation that there is, the harder these systems have to work in order to ensure that all children and young people can reach their full potential. So, why should policymakers listen to young people? I mean, certainly because children have a right to speak out and policymakers have an obligation to listen. And it's also because in speaking out, young people are giving policymakers the opportunity to make better policy. This is also clear from presentations I've seen at this conference. But this will only happen if policymakers actually listen to what young people tell them. And this point is repeatedly made by the commissioners for children, the national and state commissioners for children around the country, and other advocates. But more important as well, in encouraging young people to speak out and listening to what they have to say, acting on what they say is not only about better policy design, it also gives young people buy-in. And in listening to and acting on what young people say, policymakers are giving them a stake as citizens in the democratic process. Conversely, not acting on what they say has the potential to destroy trust that might develop between policymakers and young people. What policymakers need to do, moreover, is ensure that they act on what young people who are most marginalised in the Australian context have to say about their lives. So not just everybody, but also the most marginalised. Because these are the young people who are targeted most by the social policies that we're all concerned with here. Now, the Minister mentioned the National Framework for Protecting Australia's Children. It's a really important document. It states that, and I'm quoting here, the best interests of the child are at the centre of the national framework and the subsequent action plans. We're committed to ongoing and meaningful engagement with children, young people, parents, carers and communities. Listening to the voices of children will be the key to our success. So what have children and young people been saying recently? Well, the Children's Commissioners and also, for example, the Mission Australia's youth surveys have been very active in soliciting young people's views across a whole range of issues. And they've highlighted concerns about discrimination experienced by young people from Indigenous and diverse ethnic backgrounds, worries about education, concerns about stress, anxiety, and mental health. And many of these concerns have been accentuated by the COVID pandemic, which caused so much disruption. The Australian Human Rights Commission and the Department of Social Services also published a report late last year. This was led by Anne Hollins, Keeping Kids Safe and Well, Your Voices. And the purpose of this report was to inform the implementation of the national framework for protecting Australia's children, part of the meaningful engagement that I've just referred to. And for the report, children and parents were asked, what are the three most important services and supports that you think could help children and their families to be safe? And housing and basic needs, for example, food and clothes, came high on the list of priorities. And among adolescents who were surveyed and who participated in it, over half identified basic needs as one of the three most important supports. Now, as part of the Australian Child Wellbeing Project, I've been involved in research that sought out children's views on the good life and the challenges they faced in living a good life. Together with colleagues at the University of New South Wales and the Australian Council for Educational Research, we engaged in in-depth discussions with young people who were mostly marginalised in the Australian context. That is, they came from diverse ethnic backgrounds, or identified as Indigenous, or were material disadvantaged, or lived in out-of-home care, or were disabled, for example. And these marginalised groups were identified in consultation with the Commonwealth Department of Education. We used these young people's perspectives to design survey items that allowed us to examine well-being in contexts of both affluence and disadvantage. And we wanted to design the survey so that young, marginalised people could see themselves in it. And that's not necessarily the case with all national surveys, which often aim more for the average person. our aim was to develop a nationally representative survey that foregrounded the concerns of marginalised young people in survey design. As the Minister pointed out, you need the statistics if you're going to act. So we rolled out the survey, about 180 schools, about 5,400 young people responding. And it's worth noting that over a quarter of the respondents to this survey were identified as belonging in one of these marginalised groups I've just referred to. So it's a big group. Marginalisation is not a small issue. It's quite a large issue in Australian society. And when we talked with young people in developing the survey, we asked them to nominate material items that they thought were important for them to lead a good life and feel included. And items they nominated included, for example, a mobile phone, which most children have these days, the right clothes to fit in, pocket money, and being able to go on school camp, which most children manage to go on school camp. And the chart shows here the percentage of young people who reported being deprived on none of these items on the left, and then on 1, 2, or 3 or more items towards the right. And that's the deprivation score on the horizontal axis. And then the percentages are shown for different marginalised groups, including young people with disability in blue, young carers in red, Indigenous young people in green, and young people from non-English speaking backgrounds in yellow, and young people who weren't in any of these groups in grey there. And the chart shows that young people who are not in any of these groups have much lower deprivation scores than young people who are in any of the marginalised groups. And on the other hand, young people in all 4 marginalised groups on the right there are considerably more likely to be deprived on 3 or more items than young people who are not in any of these groups. So material deprivation and other forms of marginalisation very often go hand in hand. And young people's perspectives show that material deprivation is not only a matter of going without, it's also strongly associated with experiences of exclusion, including bullying and victimisation, not getting adequate support from teachers, and low levels of school engagement. And this figure from a recently published paper using the same data shows the relationship between these same deprivation measures that we were just talking about and 3 schooling-related outcomes. So a scale that captures the experience of bullying, a scale that measures young people's perception of the support they get from teachers, and a scale that measures their overall satisfaction with school. And again, the figure shows that those who are deprived on 3 or more items, and those are the dark grey bars there, experience significantly more bullying than other students, and particularly significantly more than students who report no deprivation. And those are the bars, the yellow bars there. And students with high levels of deprivation also report significantly less teacher support and lower satisfaction with school compared with students who report no deprivation. Now, these findings mirror other studies that also show a strong relationship, for example, between socioeconomic status and school outcomes, including academic outcomes. And we argue in this paper that these issues, such as bullying, are often treated as matters that require individual interventions. But we need to step back from that and think about the structural factors that result in marginalised people experiencing these kinds of negative school relationships. And we argue that it's these structural factors that are holding back many young people from reaching their full potential. So the Minister mentioned hunger. And we asked young people as well about how often they went to school about hungry. And again, young people with disability, young carers, Indigenous young people, young people from diverse ethnic backgrounds were significantly more likely to report going hungry than young people who are not in any of these groups. And again, our analysis suggests that marginalisation is in large part a structural issue that demands a structural response. So we talk to a lot of young people, and when we talk to them, the issue of food often comes up. I'll let you read this quote from this young girl we talked to. It captures, to my mind, the sorts of challenges that families face in keeping the lights and heating on and feeding everybody. Another story we commonly heard was about money running out a couple of days before payday, which meant that young people often had to go to school with no lunch or not going at all. Parents often kept their kids at home if they couldn't give them any food, which is, quite understandable. It's also apparent to us that young people were often reluctant to talk about not having enough food and going hungry. Our sense was that sometimes young people were protecting themselves and their families from outside interventions, that revelations about hunger might trigger some form of intervention that they and their family might not welcome. So they're trying to protect their family from these kinds of interventions. And the issue of trying to avoid interventions is something that I've seen as well come up in other presentations here in this conference. So here, children are playing an active role in protecting their families, but there's also an issue then about how interventions actually, or how services actually approach these children and their families. So what I've tried to show so far, using young people's perspectives, is that belonging in one or more marginalised groups is associated with poverty, deprivation, and hunger, and that young people in poverty are not reaching their full potential. Now, as I suggested, I want to argue that this is driven by structural inequality in society. And I also want to argue that the COVID pandemic sets a precedent for radical policy action in this space. So our research across a number of projects has shown that policy is failing in many young people. And living in a highly unequal society, they are not getting the support they need in order to reach their full potential. Now, this point is made by Michelle Jackson in her book Manifesto for a Dream, which focuses on structural inequality and policy in the US. But the problems of inequality that Jackson discusses are recognisable in the Australian context. These problems have been laid bare by the COVID crisis, for example, the extent to which economies have relied on low-paid workers to keep healthcare and food deliveries going, and the unequal impacts of lockdown on people in terms of material well-being, health, and educational outcomes. However, as several other commentators have noted, the COVID crisis also revealed the deep pockets that governments have to tackle policy problems when they're faced with a crisis situation. To give an example, the Australian government spent $89 billion on the JobKeeper scheme, or about $113,000 for every job saved. This was arguably more than just a payment to keep employees from falling into unemployment and poverty. This is an active poverty policy to maintain relationships between employers and employees. In addition, more money was spent temporarily increasing the job seeker allowance and upgrading free healthcare services. This kind of money opens up possibilities for radical reform to tackle structural inequalities that are evident in Australian society. First, however, in order to develop a sense of policy action that needs to be taken, it's worth outlining how Jackson characterises the ways in which inequalities between families are exacerbated by inequities and complications in service provision. Michelle Jackson, she talks about Chloe, on the left there, who comes from an affluent family where publicly provided services are perceived to be of low quality. Chloe's parents can buy quality services for her. And we see this in the Australian context, for example, with parents often sending their children to private or non-government schools or purchasing health insurance or other private support services. Jackson argues that higher quality services tend to be better coordinated, and as Annette Leroux shows in her classic book, Unequal Childhoods, affluent and articulate parents are well positioned to advocate for their children and demand high quality services and coordination between services. Moreover, affluent parents tend not to be concerned about their children being sent down what you might describe as the carceral pipeline that runs from child protection to criminal justice. Services, therefore, are often seen as more benign. Contact with services is not so much a source of worry in terms of where it might end up, as we've seen with other children that we've talked in relation to hunger. And then we've got Kayla there on the right. Young people and other members of low-income marginalised families like Kayla are quite likely to come into contact with a lot of services, a lot more than Chloe would come into contact with. Not just education and healthcare services, but also income support services, disability and other community services, as well as perhaps child protection and law enforcement or criminal justice. It's worth noting that a study by John Lynch at the University of Adelaide shows that by the age of 10, around a quarter of South Australian children will have contact with child protection. Michelle Jackson points out that there is often very little coordination between services that disadvantaged young people come into contact with. And again, this has been an issue that's come up again and again in the presentations I've seen at this conference. And moreover, young people who are marginalised and often live in disadvantaged communities or suburbs may only have access to services where resources are stretched, so that the quality of services is impacted. And this is brought out clearly by the recent report Dropping Off the Edge, which identifies the most disadvantaged suburbs in Australia and shows the persistence of disadvantage in these communities. The vast majority of those suburbs that were identified as disadvantaged in 2021 were also disadvantaged the last time they did the survey in 2015. And the report quotes people living in these disadvantaged suburbs as highlighting the lack of a policy strategy for supporting them. Also, I noted a minute ago in the context of talking about hunger, that young people worry that some of the services that they and their families come into contact with could make their lives worse rather than better through surveillance and risk management and essentially often what they see as punitive approaches. So it's not just that the services may not be coordinated, it's also that young people themselves may not have a positive view of what these services are supposed to be doing. So how to turn this around? Some of you may be familiar with Hilary Cotton's book, Radical Help, which is published in 2018, and it looks at the organisation of welfare support services in the UK. Like Michelle Jackson, she characterises the welfare state as a bit of an uncoordinated catastrophe where families who are in contact with lots of services are concerned. This is shown in evaluations of support services in Australia too, for example, in child protection cases, where services are often not well coordinated either. Cotton's analysis is supported by other research which suggests that towards the late 20th century, the welfare state in many OECD countries progressed gradually from a paternalistic approach to clients towards a more transactional, low-trust approach, in keeping with the principles of new public management, where service providers compete on market terms for contracts to provide services, and clients are characterised as agents who respond to economic incentives. Cotton points out that the role of the welfare state is to provide support in the context of a social contract which emphasizes control, containment, and auditing of resources. And these things are clearly important, and we see that through lots of royal commissions where services have failed and a point is made repeatedly about the need for accountability. But she argues as well, though, that the result is that the welfare state is not doing the job of enabling people, which should be its principal aim. And she argues that a welfare state fit for the 21st century needs to be more positive and more proactive. So it shouldn't be focusing on fixing problems and managing needs, but on growing and developing people to their full potential. And more than anything else, Cotton emphasizes the importance of moving away from a transactional culture to one that focuses more on relationships. And this, to my mind, is the most important message from her analysis of the welfare state. And this point has been, again, an overarching feature of presentations I've seen at this conference. The issue of trust has come up several times. How can governments and service providers establish trusting relationships between communities and young people? And this conference has highlighted numerous examples, both of where trust has been established, for example, through listening and acting on what young people say, and also through co-design. However, as this issue has been well covered in other sessions, I want to return to where I started. So relationships matter and the quality of services matter, but so the resources and fulfilling basic needs. So this chart here shows the relationship between public social expenditure on families and child poverty in OECD countries. The vertical axis represents the percentage of children in poverty, defined as living in a household with less than half median income for the country. Although I take the Minister's point, we don't really want to get into an argument about how exactly poverty should be defined. The horizontal axis shows public social expenditure on families as a percentage of GDP, including family and child allowances and credits, for example, family tax benefit in the Australian context, childcare support, income support during maternity and parental leave, and sole parent payments. So the graph shows that there's a negative relationship between the size of public expenditure on families and the percentage of children in poverty. You can see that from the regression line that runs from the top left to the bottom right. So countries below the regression line do better than expected to the extent that their poverty rate is lower than perhaps would be expected given the level of public expenditure on families. And most notable here are Denmark and Finland, which have high levels of public expenditure on families and child poverty rates of about 5% or less. On the other hand, on the other extreme, we've got the US, which has public expenditure on families of about 0.6% of GDP and a child poverty rate of over 20%. And Australia sits in the middle, just above the regression line, with a child poverty rate of about 13% and public expenditure on families at just over 2% of GDP. So it's a constant message of organisations such as UNICEF and also AIFS here in Australia that increasing public social expenditure can result in lower child poverty and lower inequalities between children. And here I'm showing the trend in public expenditure on families and child poverty in Australia in recent years. The blue line shows that public expenditure on families stayed roughly constant in real terms between 2009 and about 2015, before declining quite steeply until 2017-18 and beginning to increase again in 2019. In 2019-20, public expenditure on families amounted to $38 billion. Child poverty over this period, which you can see from the red line above there, remained fairly constant. It certainly didn't decrease. Indeed, it hasn't really changed much in Australia since the early 2000s. And this slide, which is taken from the AIFS report on poverty in Australia during the COVID pandemic, shows the effect that the introduction of JobKeeper wage subsidies and temporary increases in job seeker allowance had on overall poverty in Australia in 2020. Thanks to these payments being introduced, poverty in the country actually went down in the initial phases of the COVID pandemic. So we can see that the estimated poverty rate without these measures would have been around 22.7%. This is overall poverty, not child poverty. But it actually went down to less than 10% as a result of these COVID-related measures. So this shows, to my mind, what governments can do when they decide that something is important enough. And it's worth bearing in mind, too, that the Australian government, what the Australian government spent on JobKeeper in 2021 was more than twice what they spent on family supports in 2019. So just to finish up, a couple of things to focus on. Firstly, listening to children and young people and acting on what they say matters. Policymakers are committed to supporting every young person's right to development to their full potential. This is in the National Framework for Protecting Australia's Children. It's in the Alice Springs Declaration on the Aims of Education. It's there in policy. It needs to be acted on. How policy addresses service needs and how it can deliver better relationship-based services that young people value needs further development. And lots of people are discussing that issue at this conference, and it certainly needs attention. But the task of supporting all young people, including marginalised young people, to reach their full potential and provide quality support to particular needs of young people, this will be much easier if policy also addresses the fundamental problems of poverty and inequality in society. The less poverty there is, the less hard the other services have to work in order to do their jobs. So Bob Hawke set himself an ambitious goal in 1987. More recently, Canada has introduced a comprehensive poverty reduction target. New Zealand now has a child poverty reduction target to reduce child poverty from 16.5% to 10% between 2017 and 2023. And it's worth noting that Sustainable Development number 1.2, which Australia signed up to, states by 2030 to reduce by at least half the proportion of men, women and children of all ages living in poverty in all its dimensions according to national definitions. So I would like to think that it's time for Australia to follow up on this commitment. Thank you.